Hi everybody, my name is Dr. Eric Herman, and this is my patient Brittany. Say hi to the audience.
Hi guys.
This is Brittany's second visit, and she had the ring dinger decompression pull the first time, plus the rest of the treatments. You came in, your hips were bothering you, your low back was bothering you. You had a really intense pregnancy, right?
Yes, very intense.
How long?
Pregnancy.
Tell them how long your labor was.
57 hours.
57 hours. All the women are going, ugh. The guys don't know what the heck she's talking about, but that's intense, right?
Yes.
A lot of stress in your lower back, all that compression from those contractions, right?
Yes,
okay.
And then an emergency C-section, which is a whole other thing.
Then an emergency C-section, so there's also more trauma down there, right?
Yes.
Okay. After that, what started happening? Your lower back was bothering you?
My lower back was bothering me. I tried to exercise and walk, and I would get pain in my hips. My left hip would click. My back, my neck felt very tight and compressed. And I also carry around a 23-pounder every day, so.
How old's the baby now?
1.
Okay, so this was a year ago.
Yeah.
Right? And has it been getting progressively worse over this past year?
Yes. So I came to you exactly a year. It was her first birthday, the first day I came to
For
you.
real?
Yeah.
You didn't tell me that. That's really cool. So that was a good birthday
It was my gift to myself.
Yeah, to yourself. Good. And so you had the treatment, and then you had the ring dinger, right?
Yes.
What was your experience of the ring dinger, and then afterwards, how did you feel?
It was intense, but it was like a good intense.
Yeah.
I was a little sore the 2 days after, but I think it's my body just adjusting to being realigned.
True, 100%. The body compensates when it's out of balance, makes little changes to give you the best possible balance point it can, but it's not ideal. And then once we start fixing the main problem, all those little compensational things all have to reverse. So sometimes there's soreness involved in the healing process, which is probably what was going on with you.
100%.
Now we're walking back in a little over a week later, right? This is your second one?
Yeah.
How's the pain now compared to when you first came, before your first
Much
treatment?
better. It's from like a 6 to a 3. So.
6 pain level to a 3. That's not too bad after one treatment, right?
Yeah.
And it was pretty much a 6 pretty consistently for that whole year?
Yeah.
Kind of thing? Good.
Pretty much.
Good. Very pleased with that first visit.
Yes.
So she committed to 3 more ring dingers, and now this is going to be the second one right now. We're going to examine her right quick on my chiropractic table and probably do some adjusting here. And then we're going to bring you into my new ring dinger room, and we're going to set you up, and you're going to get your second ring dinger.
Sounds good.
Okay, any questions before we get started?
No.
Okay, come on down on the table, face down, relax. I'm going to check a few things. Comfy?
Yep.
Okay. Let's see what we got going on today. Can you scoot down a little bit towards me? Good. Okay. Bend up your knees. When I do this, are you feeling pressure in your lower back at all, or just your legs?
Yeah, a little bit.
Yeah? Okay.
Like right here.
Right in the middle?
Yeah.
Got it. Okay. So now I'm going to push a little here on your tailbone. I want you to, one at a time, start with this leg. Keep it straight. Lift it as high as you can. Okay, good. Down. Try the other side. And down. Did one side feel easier, one side feel tighter, or was it
my right side felt tighter.
Yeah, and I think I saw, maybe you guys saw too, that wasn't going up as easy. So that tells me there's a sacroiliac. That's a positive orthopedic test for a sacroiliac problem. And the fact that your back got tight when I bent it, there's definitely problems still here. So we're going to start working on this with the drop table. So just relax. If there's anything that you're not happy with, doesn't feel right what I'm doing, please let me know, okay?
Yep.
Relax. Good. Oh, gotta tighten it up a little bit. Good. It's a loud one. Nice. So we're going to do a little extra on this side to really release the joint between. The sacroiliac is named after the 2 bones that it connects. The sacrum is the tailbone, the iliac is the hip bone. There's a joint in between called the sacroiliac joint. And yours on the right is pretty jammed. So this is unjamming that joint. Good. Does that hurt?
Nope.
Nice. We're going to come up the spine a little bit. This is L5. Good. L4. L3. Relax. Nice. Relax a little more. Good. Just come up a little bit. Nice. Good releases up there. All right, lift your belly a little. Good. Okay, feels a little bit looser to me. Let's check to see how you feel. Ben, is that pressure less or same?
Less.
Excellent. And I'm going to push down here. Let's do the straight leg lifts. Lift this one first. Okay, now lift the other one. And any different here or no?
Not really.
Same? Okay.
Yeah.
All right. I'm going to do a little massage in there because the muscles are still pretty tight. Some people use their hands or their elbows, but I got this handy dandy awesome massager called the Hypervolt. Saves my hands and my elbows. Does all the work for me. This is ouch or tickle. I saw you twitch a little bit.
It's just a weird feeling.
Just weird. Just releasing the gluteus maximus, the gluteus medius, the glute muscles. What was that exercise guy's name in the 80s? He used to call the butt the buttissimo. You remember him? He had infomercials and he sold some kind of, I don't know, the things I think of when I'm treating. We're jackhammering your buttissimo. I can see his face. I can't remember his name. While I'm doing this, I want to give a shout out to Dr. Johnson, who created the ring dinger and trained me and certified me. Thank you very much, sir. You're an innovator. I respect you greatly. You've done tremendous work for the people in this world, but also for the chiropractic profession. Never before have I had patients coming to me asking me for chiropractic treatment. Most of my career I had to go out and market to get them to come to me. Now they're coming in saying, hey, you guys do the ring dinger? Yup. And that's from all the hard work and the brilliance of Dr. Gregory Johnson, Advanced Chiropractic in Houston, Texas. Check him out on YouTube. He's a great doctor and a good mentor for me.
Was it Richard Simmons?
Richard Simmons? No. But I remember him too. Oh, we could say a lot about him, but no, not Richard Simmons. Okay. Let's double check. See if that made any difference. Okay. Just lift this one as high as you can. No bending. No bending. Wow! Try again. Okay, try this side. Okay. I think you guys can see, I can see, you can't see, but did that go up easier?
Yeah.
Because it went up like twice as high. So that's a very good thing. That's good. Okay. Now we're going to do a little releasing in here, in your thoracics. Good. For you guys out there, I think it's important to understand the ring dinger pull is an amazing, like innovative, like probably the best release for the lower back that I've ever come across, but it's not standalone. There are other misalignments that happen in the spine that require other treatments, which is what I'm doing now. So to get a complete release and a complete adjustment, this stuff is required, and then the ring dinger is the icing on the cake, so to speak. Good. Without getting technical. If you want technical, there's 3 axes that the spine moves in. Y, there's the Z, and then there's the X. So bones can misalign this way, they can misalign this way, and they can misalign this way. So the ring dinger decompresses this way, but it doesn't do it if it's side slipped or if it's crooked or if it's rotated. That's what this treatment here helps to correct. But you put them all together, amazing results. Quicker than I've ever seen before, and some of the toughest cases are getting well. It's amazing. Okay, so just relax. We're going to release the transition area between your neck and shoulders, get some more function there. Look up, tilt sideways, relax. Nice. You hear that?
Oh yeah.
That was not an earthquake tremor. That was Brittany getting adjusted. Look up. Nope, no side. Now tilt, tilt, tilt. Good. Good. Back in the center. So that's moving much better. Okay, roll over on your back for me. How do you feel as you're rolling? Any different?
Yeah, good.
Awesome. Okay, scoot down just a little smidgen. Okay, a little bit more right there. Good. Now bring your arms straight out. Good. This is going to adjust some of the shoulder and the collarbone. Just relax. I got to get the tension right. I must have had a big guy on there before you. Big 300-pound power lifter. Good. You okay with that? Mm-hmm. That's the collarbone. Good. Relax. Now we're going to do the ribs. Gentle. Good, because the ribs can get jammed too. Relax. Good. And a little bit more of the shoulder. Good. Hands on the belly. Good. Let's work on the ankle, the knee, the hip. So just heavy, heavy, and sometimes the lower back. Drop. Stay as heavy and relaxed as you can. Just relax. Nice. Same thing here. Drop it in my hands. Good. Relax. Nice. Okay. You ready? Come on, sit up. And we're going through there into room number 2 with a view to do the ring dinger.
What
Yep.
do you need me?
Yep. Put your head right here. Just relax. Hands on your belly. I got to tickle you to find your ribs. I mean your hips. All right, scoot down about an inch or two. Right there, perfect. Now we got to pin you in like last time. Hold on. I think we need to shift your whole body that way just a little bit. Right there, good. There we go. Good. Now, can you pull your body up at all?
No.
There's no movement. Okay.
No.
Relax your legs. The legs are going to come up. Right about there. Okay. Today we're going to use. Lift your head. Lift your head up. No, head up.
Oh, sorry.
I'm going to use a towel to grab. So it's the same thing, but see how I pull here? See the grip?
Yeah.
So just relax. Relax. Do me a favor. Nothing. You okay?
Yeah, that was awesome.
This is for you, Doc. She's still kicking. Lift your head. Oops. Now check your neck. Good. Relax. Good. Now I'm going to lower you down. Did you feel it as much in the lower as you did the first time?
I felt it more in the upper this time.
Okay. Did it go release the lower at all?
Yeah.
Yeah, good. It releases where it needs to release.
Yeah. That was awesome.
Cool. Alright, when you're ready, come on up. Take your time. We're going back in here.
Okay.
Alright, now have a seat for a sec. How do you feel?
Good.
Is there any pain in your back presently?
No.
If you want to stand up, kind of like bend around a little bit and see.
No.
Is it sore?
No. Not like last time.
Good. Usually the second, third, and fourth you don't get as sore. Sometimes you do, but usually not as much. Pay attention to how you feel And if it starts coming back, note how long between now and when it comes back.
Okay.
That helps me determine what kind of a frequency you should probably come back for.
Okay.
But I'm going to say, if you want, come back in 1 week again.
Okay.
If you come back next week and things are still holding as they are now, then at that point we're going to look at stretching you out. Maybe we'll do every other week. And then we'll keep weaning you off and monitor your body to see if your body can handle it.
Okay.
Right?
Yeah.
All right.
Cool.
Thank you. Good
Thank
job.
you.
You're doing great.
Awesome.
Thanks, everybody. And look for me on YouTube at Guru Chiropractor. If you like what you see, please hit like and follow me and hit the notification so when we do more videos, it'll come right to your computer. Thank you very much. Have a great day.